Have you ever complained of back pain or known someone who has? If you have, you know that back pain can be debilitating. Back pain is a common complaint, and anyone can be affected by this. It is affected by quality of movement, joint mobility, and ability. This could be if there are any changes in the joints that can change the pattern of movement. Tissue tension, which can be brought on for a number of reasons, including daily habitual postures and movements, such as sitting. When we think about posture, I often get asked if there is a good posture. Something to remember is that posture is dynamic. Depending on the movement, however, there may be a more optimal posture to others to prevent tension or pain. Constant movement habits and postures can lead to tissue tension felt in our bodies. Over many years, tension can also lead to further joint and movement restrictions and therefore reduced movement ability. Tight hip flexors, although infamously talked about, may not be the only reason for your back pain, but can play a role. Movements of the lower body can help us understand why we are having back pain. Let's get into how you are walking. Do you have hip extension? If you are someone that sits frequently, constant sitting can increase the tightness of our hip flexors and reduce the good joint mechanics at our hip. Active hip extension is essential for good mechanics and good movement through our tissues, including at our lower back. Hip extension helps lengthen the hip flexors and improves joint and tissue mechanics below the hip. This means at your knee, ankle, and toes as well. Better joint mechanics can mean lower frequency of back pain. I suggest that you make this one change to your walking gait and see how this affects how you move and how you feel, especially at the low back. Most people with tight hip flexors will bend their back knee during toe off. This is the moment in gait when you push off the back leg. There should be a moment that your knee goes through a straight position, not hyperextension and also not always in a flexed position. Pay attention to how you are walking and make a point to straighten your back knee when you are pushing off of your big toe. By toeing off with a straight knee, you will improve movement quality, not just at the hip, but at other joints in the body as well. You will likely increase your hip extension over time. This can change your tissue tension, lengthening some tight structures that may be at the front of your hip, and create new movement habits and patterns. When we think about walking, there is a moment when our hip must go into extension. If we have muscles in the front of the hip, so your quads or your infamous hip flexors, that are tight or restricted, when we toe off, so this is the action of our big toe being on the ground, we will be limited by the tension in the front of the hip. And then what we get is this femur bone being pulled forward and therefore a bend in the knee. So what I'm suggesting for you to pay attention to and bring your awareness to is how you are walking and trying to force that knee extension without letting your pelvis tilt forward too much so that we're not creating more back pain. What you should feel is that glute max activating and maybe contracting a bit, as well as quad stretching or hip flexor stretching in the front area here.